Great. Hi, everyone. Thanks so much for joining the webinar. Welcome. We're just going to give it another couple of seconds while our attendees jump on the line. Great. Thanks so much again for joining, everyone. My name is Kate Morars. I'm the Deputy Director of Public Health at the Hepatitis B Foundation and Director of Hep United. We're really excited to present today's webinar on hepatitis B outreach among South Asian communities as part of our Hep United webinar training series. Before we get started on our presentations, I wanted to just share a few features. As you are most likely already familiar with Zoom, but wanted to point out how to participate in our conversation today. All attendees are unmuted, but please feel free to say hello to everyone in the chat box and introduce yourself, where you're coming from, your organization or your location. We'd love to hear from you. And then if you have any questions, just a reminder to place your questions in the Q&A window, just so that we can keep track of them and they don't get lost in the chat box. And then wanted to let you know that the session today is being recorded, so we'll be sure to share a copy of that. We usually post them on our Happy United's YouTube channel, and we'll share that with you afterwards, as well as a copy of the presentation slides, which we'll post on our website. Hep United is a national coalition of over 50 local community-based hepatitis B coalitions and national organizations. There's a map here of where Hep United partners are located, including in 30 cities and 24 states, plus the DC area. And we're really happy to have presentations from two of our Hep United partners from Michigan and New York City today. Our coalition was started in 2012 with a mission dedicated to reducing the health disparities associated with hepatitis B. And we're working to improve awareness, increase testing, vaccination, and literature care for all communities that are highly impacted by hepatitis B in the United States. So today we are going to be focused on talking about hepatitis B and impact on South Asian communities in the US. And we have really great presentations and communities represented on today's call. Our first speakers will be Shaylee Gandhi and Adiba Khan from the New York City Health Department, and they also represent NYC Hep Free Coalition South Asian Hepatitis Initiative. And then following Shaylee and Adiba's presentation, we'll be transitioning over to Mohammed Saiful Islam and Abdullah Islam, who will be talking about their work in the Detroit area of Michigan. So without further ado, I'm going to turn it over to Shaylee and Adiba.
Hey everyone, thanks Kate for that introduction. I'm Shaylee Gandhi. I am the Viral Hepatitis Program Assistant, and Adiba and I are going to tell y'all a little bit about the South Asian Hepatitis Initiative. So first, I want to share with you all some statistics regarding hepatitis in the South Asian population. So as per the World Health Organization, 410,000 people in the Southeast Asian region die due to viral hepatitis each year. So this means there are approximately 40 million people in the region living with Hep B and approximately 10 million people living with Hep C in that region. And in New York City specifically, in 2018, 2.5% of people with Hep B who gave birth in NYC were born in Bangladesh. And in 2019, 4% of South Asian pregnant people who gave birth in NYC had Hep B as well. And then finally, in 2018, 2.6% of people tested positive for Hep C were of Pakistani background. So when we talk about hepatitis, we do consider the Asian population, especially for Hep B, which is considered endemic in Asian countries. But the South Asian community can sometimes get lost within this giant umbrella of Asian. So through our work at the Viral Hepatitis Program, we noticed a dearth of resources for the South Asian community, despite these numbers showing the prevalence of hepatitis in this population. And this is kind of what led us to create the South Asian Hepatitis Initiative. Next slide, please. So we have a few main goals with the SAHI Objectives. First is to raise awareness about Hep B and C among South Asian-born diaspora populations, especially in New York City, but also globally. We also want to provide services such as screening, vaccination, referral services for Hep B and C treatment, and liver disease services in South Asian-born and diaspora populations. We want to build community and provider partnerships for Hep B and Hep C prevention for South Asian-born and diaspora populations. It is especially important that we find clinical connections that have the cultural competency to treat this particular group of people. And then finally, we want to identify and reduce cultural and linguistic barriers to getting hepatitis treatment. Next slide, please.
Thanks, Shaylee. So this is Adiba. I'll be taking over from here. When we were looking into our objectives, we noticed that most of our issues came from people not knowing about what is hepatitis B and what is hepatitis C. So even though people were testing positive and living with Hep B and C, they did not know what that meant. They did not know what that entailed, what treatment would look like, or if they even needed to be in treatment. So to address this, we created some materials of our own. And to make our materials, we first looked at what was available. There weren't actually too many things available. And the biggest barrier we saw was language. There were a few materials available for the New York City Health Department and for the CDC that were available in English, and some of them we were able to get translated into Bangla and Hindi. One of them is available also in Urdu. However, we want to create our own materials that targeted this population, that use these images that show South Asian people that look like you and I, and that people can really look at, relate to, and if they're walking by, they're like, hey, that looks like me, or hey, that's a very colorful piece of material. I'd like to look at it a little bit more. So starting off, we created the Hep B and Hep C postcards, and we also made them available in Hindi and Bangla so far, and we're working on also making them available in Punjabi and Urdu going forward. So as you can see, they focus on testing, they provide information on transmission, and they also have our information on where they can find out more information and where they can find testing. So this is also part of our Hep Free NYC initiative. So as you can see, there's one postcard. This is front and back. So on the left side, you'll see the front side, and on the right side, you'll see the back side of what these postcards would look like. So the one that's in orange and red are Hep B, and the ones that are in green and purple are Hep C. So we wanted to keep it a little bit more consistent because we know that the population is already confused. What is hepatitis? What's hepatitis B? What's hepatitis C? So we try to color coordinate things. So everything that's red and orange are going to be Hep B, so everybody knows visually, and everything that's green and purple are Hep C, so people can also see that visually. Next slide, please. So to go along with that, we understand that a lot of people might not have the resources to go on the internet, or maybe they're not comfortable to reach out, or they're not at that step yet. They might have questions right away, or maybe our partners are using our materials. And I do want to mention our materials are available to the public if anybody wants to use them. If anybody wants to just get information right away, we created our Hep B and Hep C pocket cards. And these focus on more detailed information on what's Hep B, what's Hep C. It talks about transmission. It talks about what the testing process looks like. For Hep B, we focus on vaccination, and for Hep C, we focus on the treatment. So as you guys can see, again, with the red and the orange and the green and the purple, we try to keep it consistent. So ideally, the pocket cards would be folded up in an accordion style, and people can just keep it in their pocket. Maybe, they go to a doctor's appointment and they take it with them and they say, well, I have a question about this part right here. I don't know about this, or I want to get tested for this. I'm not sure. And it serves as a visual reminder of what is Hep B and what is Hep C and what they can do to take control of their health. And again, at the bottom, we put down our information where they can find testing and care, as well as reach out to us so that they can get more information. Next slide, please. So that was the materials, the physical materials that we'd give out to community members, or that our partners would give out to people in the community, people that they serve. We also wanted to address the people that we serve, because we do have a lot of partners that may also want to address the South Asian population. So we wanted to create a presentation, and that is based on the New York City Health Department's Hep B and C basics. And we want to make sure that this presentation was focused towards the South Asian population especially. So we made sure that our slides were culturally relevant. They include what exactly is Hep B when it comes to South Asian population, and for the Hep C for the South Asian population. So for example, we've noticed that even though Hep B and Hep C may be spread more by injection drug use, or something similar, like person-to-person sexual contact, for Hep B in the United States, or for other populations. For the South Asian population, we've noticed that actually Hep B is spread more from mother to child transmission, not from sexual contact. And for Hep C, it's actually more from vaccination, reusing needles, not from injection drug use recreationally. So these are things that we wanted to address within our slide set. And we also wanted to make sure that everybody else was aware about it too, because a lot of times these are taboo topics in our community, and we want to make sure that people are comfortable speaking about it, understand where this falls within our culture, and just face the reality that, this is something that we are facing as a society, and we should be all able to take care of our health. So this presentation is about an hour long. We've already delivered it twice, I think, and it's also available for the public. So we do have instructions and notes along with it, and it's also available to anybody who wants to use it, anybody who's part of an organization, anybody who's a health center staff, and serves the South Asian population. They can use this presentation to educate their community or even their staff. So next slide, please.
So I'm going to talk a little bit about some of the achievements that we've had thus far. So a big goal of SAHI was to create community connections between community-based organizations that serve the South Asian population and organizations that have testing and linkage to care capacities. So through the SAHI initiative, we were able to facilitate a relationship with Korean Community Services, which is a community-based organization that we have worked with in the past for community navigation, for hepatitis community navigation services. And we were able to connect Korean Community Services with South Asian Council for Social Services, as well as a few other South Asian CBOs, including the Hindu Temple Association, United Six, and the Muslim Women's Institute for Research and Development. And so this relationship has allowed for providing screening and testing at community health events, as well as patient education and community education also at these events. And so we worked with Korean Community Services in applying for the 2021 Hepatitis B mini grant, which they did attain. Congrats to them. And the deliverables for this grant is to partner with 2 faith-based organizations and conduct 4 screenings in the South Asian community. And it was kind of through the SAHI networking attempts that we were able to kind of create these connections, and we're continuing to create these connections and find more and more spaces where we can kind of reach the South Asian community. Next slide, please. So we have, throughout the past year or so, we've learned a few lessons. First, we found that organizations that serve the South Asian community, they care deeply about the health of their people, but there remains a lack of awareness of what hepatitis is. So there is a really great need for community health education. And this is both within communities themselves and also through like faith-based organizations, community-based organizations, so that we can actually bring hepatitis awareness to the population. We also found that there's a need to build a network of clinical providers that serves the South Asian community, specifically that have the cultural capacity, the linguistical capacity to serve these populations. South Asia has a very, very vast number of languages that are spoken and a lot of different cultures and a lot of different practices. And language can be a great barrier in receiving any type of medical services, and this is no different. So creating those safe clinical spaces for the South Asian population is really, really important. We also related to the language concern, there is a huge desire in the community to have health education material in a variety of these South Asian languages. As Adiba mentioned, some of our materials are already available in Hindi and Bangla, and we're working on translating them into a few more languages. I believe we're working on Punjabi right now. I think Urdu is also in the pipeline. So something that we're definitely moving towards is to make these available in as many languages as possible. And also through our meetings, we found through a lot of clinical feedback is that there's a need to integrate Hep B and C prevention more so into primary care settings. We have some great clinical partners who are hepatologists specifically and who are able to serve people who are already diagnosed and need linkage to care at that point. But I think that something that has come up in a lot of our meetings is the need to kind of address these issues beforehand, before they get to the point where a specialist is needed. And next slide, please. Oh, sorry. So here I just want to close out by highlighting a few of our accomplishments over the past year or so. So as I mentioned, we were able to facilitate this relationship between Korean Community Services and a number of South Asian organizations to bring screening and testing and health education to various different community settings. We have created various educational material, which we already highlighted, and that has already been translated in a number of languages, and we hope to continue to expand that. As Adiba mentioned, we've developed and presented a webinar using an adapted version of the hepatitis basic slides that is targeted towards the South Asian community. And we have held 4 external meetings with partners and potential partners to encourage networking and highlight the health concerns of the South Asian population. And finally, moving forward, we're going to continue building awareness of hepatitis in the South Asian community. We want to continue building a network of providers that we can kind of turn to, and just continuing to support community organizations for outreach and getting people tested, getting people in treatment, getting people vaccinated, and just taking care of the health of the South Asian population. Next slide, please. So that kind of wraps up our presentation. I'm not sure if Adiba has any final notes, but please join us, follow us on all of the platforms, and let us know if you have any questions.
I just want to add in that I've added our link to our materials that we've mentioned in the chat. You can alternatively also reach out to us at any of our social medias. And also I'm going to drop in our email. So if you have any questions, or you see a broken link, or you want to request a language, or maybe you can translate for us and you can offer a language, we'd be very happy for that. So please feel free to email us at hep@health.nyc.gov. Thank you, everyone.
Thank you, Adiba and Shaylee. Thank you so much. That was an amazing suite of materials that you have produced. Just Adiba, if you want to just drop it into everyone, I think you might have just sent it to us. And I did answer. Oh, okay. I think they might have gotten it. Great. So I'm going to now transition over to our Michigan partners. So I'll turn it over to Abdullah Islam from Community Welfare Services of Detroit, and you're going to pull up your screen.
Right. Thank you very much, Ms. Kate. So I'm going to share my screen. Let me see. Are you able to see the PowerPoint?
Yes.
Okay. All right. Can you see it now? The full screen?
Yes.
All right. Thank you very much. All right. Hi, everyone. Thank you very much for inviting us to today's event. My name is Dr. Abdullah Islam, and I'm here with Mr. Muhammad Saiful Islam. So we are representing the Community Welfare Services of Metro Detroit. We are a non-profit organization working in the Metro Detroit area to improve the healthcare outcome of the Bangladeshi community who are living in the Metro Detroit area. So that covers the city of Hamtramck, Detroit, and Warren cities. So our community is underserved, and we have very scarce access to resources. And there is an existing barrier to healthcare in terms of language barriers and cultural barriers. So throughout the years, our organization has developed and implemented programs that has made healthcare and health literacy more accessible to people in our community. So with the mentorship from MAHA, the Midwest Asian Health Association, our organization have been able to form a Hep B advisory board for the first time in the Bangladeshi community in Detroit. And we have conducted a needs assessment back in 2019, where we conducted a Hep B survey among the people in our community. And we interviewed about 200 people and to get an idea about their understanding about hepatitis B virus. And so in today's presentation, I'm going to briefly talk about some of the results that we found in our assessment. So let's start the presentation, and I hope you all enjoy it. So to give you a little bit of background, Center for Disease Control and Prevention, CDC, has found that in their research that at least 1/3 of the Asian Americans living in the United States are unaware of their chronic hepatitis B infection. And our organization, CWSMD, under the direction of MAHA, conducted a survey in the Metro Detroit area, and we found the same scenario existing here as well. So prompt identification of chronic hepatitis B infection is essential to ensure that infected people receive the necessary care to prevent or delay the onset of liver disease and initiate the service needed to prevent the transmission to others. Chronically infected people have years of life to gain if the medical intervention and treatments are initiated early, before the symptoms can occur. I'm going to the next slide. So this is a little bit of a demographic of our area. So as you can see in this table that there are about 11,000 Bangladeshi population living in the Hamtramck area, about 7,000 living in the Warren area, and 13,600 living in the Detroit area. So altogether, there are about 31,600 Bangladeshi population residing in the Metro Detroit area. So the occupation of our people mostly include factory workers, restaurant servers, and cashiers at grocery stores. The average income of our people in the Warren area was about $22,000 a year, and in the Detroit Hamtramck area was $12,000 a year. So as you can see, this is a very low income area. And the education level of our people in the cities are also low. So most of the people are either at or below the level of high school diploma or equivalent. And the unemployment rate among the Bangladeshi people in the cities is about 5.37%. So on this slide, I'm showing you some of the data that we collected in our survey. So we basically interviewed about 200 people in the Bangladeshi community, and we asked them a series of questions. So first of all, when we asked them if they have heard about the Hep B virus, about 66.6% of them responded yes. But when we asked them, do you know what the hepatitis B virus is? At that point, only 5.5% responded that they know exactly what the virus is. And when we asked them about if they know how to check for hepatitis B virus and how the virus is spread, only 11.11% responded that yes, they know how the virus is spread and how to check for it. And we also asked them if they know how to protect themselves against Hep B virus, and only 16.6% responded yes. And then later on, we also asked them if they have been tested for Hep B virus. And surprisingly, we found out only 5.5% have tested themselves for Hep B virus in the past. And the vaccination rate is also about 5.5%. And among the people who were tested for Hep B, we asked them if the doctors have told them if they tested positive for Hep B. And a shocking 44.4% people responded yes. So out of those 5.5% people who tested for Hep B, 44.4% of them tested positive for Hep B. And when we asked them about treatment for Hep B virus, 55.5% of them responded that yes, they have received treatment for Hep B virus. So in the end, we also asked them if they're interested in getting screened for Hep B virus in the future and learning about the Hep B virus. So about 38.8% of them responded that yes, they are interested in getting screened for the Hep B virus. So this slide is basically showing you the summary of what I've told you so far. So as you can see, the orange represents the people who do not know what the Hep B virus is. So that's like 66%. And here, a huge percent of people don't know how to protect themselves against the virus. And a very large portion of people don't know how the virus is spread in the first place. So based on our assessment, we have realized that our Bangladeshi community is in significant need for more outreach event and more education in terms of Hep B virus. And we need to initiate a screening for hepatitis B virus. And we also need to educate people about taking preventative measures and possibly start a vaccination project so can more and more people can protect themselves in the future from the Hep B virus infection. So now I'm going to talk a little bit about the activities that we have led so far. So after conducting this survey back in 2019, we formed a advisory board on Hep B virus for the first time in the Bangladeshi community in Michigan. And our community, our advisory board consisted 10 members who are community leaders, and they continuously work with people from our community. And we have held educational groups where we serve 10 to 12 people on a monthly basis for a few months. And we also have held one citywide education event in the Hamtramck area, where we were able to bring healthcare experts and professionals from the Henry Ford Hospital in the Metro Detroit area. And they were able to educate people in our community about the Hep B virus and how to protect themselves from the virus and how to get screened. So some of the outreach strategies that we have used were distributing flyers in the religious institutions, distributing flyers in the local groceries and online platforms such as Facebook and on Twitters. But we realized that we also have, among the elderly population, there are some people who are unable to read and speak English. So we ended up having to translate our educational materials into Bengali so that we were able to reach out to as many people as possible. And the young people, of course, were able to read and speak in English, so it was easier to reach out to them. But as for the elderly population, thankfully, we were able to come up with the translation for our education materials, and we were able to reach out to them as well. So the lessons that we have learned so far from our projects was that people in our community are very interested to learn about the Hep B virus, and they would like to learn more about how to protect themselves against the virus. And but we need to gain more awareness, and we need to start a screening project about Hep B virus so that we could reach out to and help as many people as possible. And we also learned that many residents in our area are still unaware of their rights and responsibilities as citizens. Some of the challenges and barriers that we came across were, we realized that the only reliable sources for information about healthcare for the residents in the area were either their primary care doctors or through the health fair events that are held occasionally in our area. And the language and cultural barriers are also present. And there are also very few hospitals in the area. And being an underserved area, some people still don't have access to healthcare insurances. So we do have some health centers in our community that that serves the uninsured people, but there are not that many of them. So the health centers are still not able to help a lot of people who are uninsured. And so we're going to need a lot more work and a lot more projects in the future. So addressing these challenges, as I mentioned before, we have been, creating these educational materials and translating them into Bengali as well, so that we could reach out to the elderly population. And for the future, our recommendation is that we aspire to address our community groups in groups of 10 to 15 people twice a month. And we would like to continue this project every month in the foreseeable future. And we're also planning on, we also intend to organize major events twice a year where we could bring in healthcare experts from hospitals in the Metro Detroit area, where they could come here and educate people in our community about Hep B virus. And then we need to start a screening project in our community for Hep B virus. And in the future, if possible, maybe we could also think about starting a Hep B vaccination project. But as you guys already know, that our area is very underserved, and it's a very low income area as well. So in the future, we're going to need more resources and more funding in the future, and more fundraising, so that we could reach out to as many people as possible. And some other points is that our community is also very massive and densely populated. So we are trying always to expand our voices and make more efforts through appropriate means of fundraising. So in conclusion, our results have signified that educating people on hepatitis B screening, prevention, and vaccination is very essential. And Bangladeshi community in this Metro Detroit area is no exception to that. And our community also wants to become the part of the World Health Assembly target of no Hep by 2030, which is basically a project that's aiming to get rid of the Hep B virus spreading in our communities by the year 2030. So it is very necessary for us to work alongside this program in the Bangladeshi community as well. So the good news is that the people in our community are very enthusiastic. They want to be educated. They want to get screened for Hep B virus and get vaccinated if possible. So hopefully in the future, we'll be able to get more support and get more resources and continue our work on Hep B virus and achieve a better and more educated society that knows how to protect themselves against the Hep B virus. So here on this slide, you see a poster presentation. This is something that we published after our needs assessment survey back in 2019. And we were invited by the Hep B Summit, the National Hep B Summit, to Washington, D.C. in 2019, where we presented this poster presentation as part of the summit. And this is my last slide here. If you have any questions, you can always contact our organization. We're Community Welfare Services of Metro Detroit. So this is our address. We're at 31100 Kenneth Street in Hamtramck. And this is our phone number and the email address of Muhammad Saiful Islam, who has been the executive director of our organization, and he has been leading most of the projects that are currently in effect. So if you have any questions, you can always reach out to him. And with that, I would like to conclude my presentation, and thank you very much for inviting us to today's event and giving us the opportunity to talk about the Hep B virus projects in the Metro Detroit area. Thank you.
Thank you so much, Abdullah and Mohammed, for sharing the work that you're doing in Detroit. We are now going to go over some questions. So just a reminder for attendees, if you have any questions for our presenters, please feel free to share them in the Q&A box. And Mohammed, or Abdullah, if you want to stop sharing your screen, I can pull up our old slides. So one question that we did have is for either New York City or Detroit and the communities that you've been working with, what would you say are the top barriers to hepatitis B screening and vaccination efforts?
I can answer for the New York City area. So for top three, I'd say the number one is language, because that's, it just stops communication right there. Having no understanding of what is hepatitis, of being able to communicate what's going on, that's the biggest barrier that we faced. We've also noticed that there's a lack of testing efforts to focus on this community in particular for the South Asian population. So we've been trying to expand on testing health fairs and with Korean Community Services, we've been trying to reach out to many communities so that we can expand the testing efforts. But the follow-up is also very difficult because it's really hard to find South Asian serving providers who can speak the language and address the concerns of the South Asian community, especially because like Shaylee mentioned, we don't have a lot of people in primary care providing these services. It's usually referred to specialists. And unfortunately, when it comes to specialists, it's hard to get an appointment. The timing might not meet up for the patients, or the patients have a hard time getting to these appointments. They may be far away physically, geographically from their location. So especially for a community that is mostly immigrants, to be honest, especially in New York City, we are a city of immigrants. It's very hard for them to navigate the system and find the care that they need because of these three barriers.
Yeah, thank you for Dr. Ms. Adiba Khan. And also, I second to that. In our community, we have come across similar issues when it comes to translating the language barriers. Like in many of our events, we realize that a lot of people, may not able to understand this medical concept about hepatitis B unless it's translated into their own language. So that has been one barrier. And also, we think that we need to organize more events, especially given the COVID pandemic last few years. It's been really difficult to organize in-person events. But hopefully in the future, when the COVID pandemic, quiets down, maybe we'll be able to organize more in-person event and, invite healthcare experts and professionals from the hospitals nearby our area, so they could come here and talk to more people. And not having access to healthcare, like a lot of people in this area still don't have health insurances, and and not having enough of FQHCs where they would serve people regardless of their insurance status. So that is another challenge that comes across. As the New York team was also explaining, having transport, and especially in Michigan, public transportation is not good enough. So a lot of people may not be able to travel to see their doctors or other healthcare experts. So, so in the future, hopefully we might be able to, organize more events and, have people, make it easier for people to travel to, nearby healthcare experts where they could go and learn more about hepatitis B virus, and encourage people. There is also hesitancy when it comes to vaccination, and a lot of people may not even feel the needs of getting screened unless we are really able to explain to them the necessity of getting screened for Hep B virus. So, yeah, those are some of the challenges that we face in our area: the lack of resources and the difficulty of accessing resources.
Shaylee or Mohammed, would you like to add anything?
I think that really does cover it. I think that finding providers who have the cultural competency to be able to kind of navigate this members of this community through care, and as Adiba said, language is really a really big one.
So it sounds like there's a lot of barriers in terms of transportation, financial, and language for the community, and just access to those types of educational materials. And then you both had touched on providers that serve the community, and that's a good segue to our next attendee question: is what is the best way to involve providers and make connections with providers that can serve the population and communities in a appropriate, culturally competent, linguistically competent way?
So for us, we've been trying to reach out to providers that we've already been working with, and we've been trying to expand our network by asking those providers to refer to us any other providers they might know in the field. Unfortunately, that is a very limited way of trying to find a network of providers, but it's what we are doing so far. It's what we've been working with our, we're just starting off. This is going into our second year. And we've been able to find a few providers who are willing to serve the community, and hopefully we'll get referrals through our partners as well. So most of the time, when we have our external meetings and we're meeting with our partners, and we are referring out into the community, we try to find those providers who are South Asian or who serve South Asian populations, and try to expand our provider network that way. Personally, I'm a healthcare navigator myself. I do navigation for hepatitis B and C myself. So if I, in my field of work, working with like all of the community in New York City, find a provider who speaks a South Asian language, or who may have access to, some sort of low income accessible means for South Asian people to get care, I would note that down. I would let my team know, and hopefully we can add that onto our resources. But that's how we're starting off, and hopefully we can expand a little bit more in the future.
Yeah, in our
Abdullah, did you want to add anything as
Sure.
an incoming family physician? How would you like that?
Sure. Yeah. So I second to what Ms. Adia was saying, that we need more doctors from this area who, likely speak the language, and who are very much know about the cultures, the people living in the community, so that they can build a trustworthy relationship with the people in the community, so people really understand the need and the necessity to go out and get screened and tested for hepatitis B. And also, we need to make these screening procedures, make it understandable to them. Like when I saw the New York presentation today, they have some excellent pamphlets and excellent presentations. So that is something for also us to learn. So in the future, we could come up with education materials like that and translate them to different languages, so that more people in our community can learn. And also, we have been trying to reach out to the new doctors in our area. Recently, a lot of immigrants community has, their children of immigrants have gone to the medical field and gotten degrees in whether it be going to medical school or PA school or other public health fields. So we're trying to reach out to more people, more doctors and more other healthcare professionals, so that we could encourage them to come to our community, and so that they could connect to our people easily, and they could make it easier for us to organize our future events. And hopefully that way in the future we're able to bring in more healthcare professionals in our community, and we're able to build a more successful Hep B project in the future.
Thank you both. And I just wanted to note, one of our audience members wanted to share that if they're asking if any of the programs have used the Project ECHO model. You may be familiar with ECHO. It's the healthcare provider education model. In this program, they train primary care providers to treat hepatitis B and C, and then patients can then see their primary care provider as well, having to travel to a specialist. Is that something that you think would resonate or work well with integrating the provider communities that serve South Asian communities?
So we have not used the ECHO model just yet. It may be in the horizon for us. So right now, again, we're still starting off. This is our second year since we've gone public, and we've started working with our partners externally. So that's definitely something that seems like, if it works, we'd be willing to give it a try. It's definitely something we could put down in our agenda of things to do once we have the capacity for it. But as of yet, not yet.
Good.
Yeah, same here.
Oh, sorry, go ahead.
No, I was just going to say the same here. Like, we have not used that ECHO model yet, but this is something interesting to keep in mind. I'm really glad that I came here and I was able to learn about this platform. So maybe in the future we might consider, implementing such project.
Yeah. And then I have another question, and then can I go back to the barriers question? And we're wondering if there's any type of stigma that exists in the community that's related to hepatitis B.
Sure.
Absolutely. Oh, go ahead.
Oh, sorry. No, I was just going to say that as Ms. Adil was mentioning, that, a lot of people, the stigma when it comes to, a lot of people are under the perception that Hep B can only be transmitted through like needle sharing or through transfer of bodily fluid. But a lot of people don't understand that, if a pregnant woman is infected with Hep B, she may pass it down to her child. And, so a lot of people are even unaware of that. And also, there is a stigma in the, at least in the Bangladeshi community, in terms of, drug abuse or people who are affected by drug addiction. So I believe that we need to do more in terms of speaking up and educating people more about the dangers of, not talking about these taboo topics, because by not having this conversation, we're falling behind. And, this virus that could have been prevented by taking early actions. I believe being more open and encouraging this discussion in our community is something very important, and this stigma is something we need to overcome in the near future.
Absolutely. And adding on to that, there are a lot of taboo topics, especially, as Saiful mentioned, it's a stigma to talk about certain taboo topics, like, for example, sexual contact, even though I always joke, we have so many kids, obviously, where are they coming from? And this is a main way that hepatitis B especially spreads. But mother to child is the main transmission, and as I've also mentioned, the needle sharing. So even though those are two of the main ways that spread hepatitis B and also hepatitis C in the United States, there are other ways that it might be shared in the South Asian community that we might want to highlight some more. So that way we overcome those topics, because we have to address things head on. We have to make sure that our education addresses things as a matter of fact. The fact is, this is how hepatitis spreads, and we need to make sure our community knows that. And I've noticed that if I feel uncomfortable speaking about it, or if I'm the one who's acting very shy about it, then other people will feel that way too. But when we approach it from this is about our health, this is just how it is, and we need to talk about it, I've noticed people are more receptive to that too, because our communities actually really like to talk about health related things. We're very forthcoming about our health conditions and learning about these topics. And I think Saiful also mentioned that in his presentation as well. So this is just one of those barriers that I feel is not so much of a hard barrier as it's a soft barrier. We just have to know how to address it.
Yeah, I think that it's especially important thinking about, because this is a small, subset of the community, kind of realizing that there are actually different modes of transmission than maybe typically kind of come to mind. As was already mentioned, drug use is super common, sexual transmission is super common, but I feel like in the US at least, we don't talk as much about mother to child transmission, because that's something that tends to be less of a concern for infants that are born in the US. But it's things like that where we have to be really careful about the specific concerns of the community itself and the modes of transmission that are relevant for them.
That's a really great point. I think that you're right. A lot of the conversation recently has been about injection drug use, and that obviously doesn't resonate as much with a lot of the highly impacted communities from immigrant communities, and that we work with as well. So I have a question about going back to the screening barriers from an attendee. Do you think that, currently there is no point of care testing for hepatitis B, unlike hepatitis C? Do you think that having a point of care test at the primary care level or being used at community centers, do you anticipate this will help encourage more people to get tested from the communities that you work with?
Oh, absolutely. Absolutely. Because what I've noticed with this community, and this is not a blanket way of looking at all the South Asian community, but once they're in care, once they're at, their primary care provider or whatever provider they're at, if they have testing that's offered to them either at low cost.
Not sure if I froze or Adiba might have.
I think her screen froze.
Oh, okay. Well, maybe we can come back to that, but Shaylee or Mohammed or Abdullah. Oh, we got you back.
I'm back.
Sorry.
Yeah. Sorry, my internet dropped off for a second. So as I was saying, if there is a point of care, way of getting tested, either while they're already in the office, I feel absolutely people would take it if it's low cost or free and offered to them. Absolutely, people would be jumping on that, because it's like they're probably getting a bunch of tests as it is, and this is a community that does want to take care of their health and is very forthcoming when it comes to things that are health related. So I believe that absolutely people would take advantage of it, and it would increase testing rates.
Yeah, kind of adding to that, making testing more readily accessible is never, ever going to hurt. It is only going to help. Um, and yeah, like if you're already going to see your PCP or whoever, and if you're already getting certain tests done, it's so easy to just kind of add, one or two more onto that if once you're already in that headspace and in that setting. So absolutely, I think that can only help.
Sure, same idea here. And as I was mentioning, the transportation is a very difficult problem. So if someone has to go to a long distance to do their testing, they won't be eager to do that. But if they can do it at their primary care physician's office, or if they have point of care testing for Hep B, that would help a lot of people get tested.
Thank you. Sounds like there is really a lot of opportunity to make progress in hepatitis B education and testing in the community, as you said, Adiba. It sounds like people are open to talking about their health conditions, so that's definitely a plus. I feel like we just definitely need to get more education and information out there. I think a lot of people were not aware that there is a South Asian Hepatitis Initiative, and so it's wonderful that there are already materials that exist and then we can be shared broadly with our partners around the country. So I wanted to end with one last question. It was something that Abdullah, you had mentioned in your presentation, just because it kind of sparked my interest around rights and responsibilities. You said that a lot of the communities that you're working with are not aware of their rights and responsibilities. Can you expand upon that as it relates to their health? I'm assuming as it relates to their health care, and how that relates to hepatitis B.
Sure. So yeah, a lot of people, a lot of people living in our community, they are recent immigrants who came to this country. So a lot of them are unaware of the vaccination schedule that's recommended by CDC, and they are not aware. Many parents are not aware, like their children, they need to get vaccinated. So a lot of them are even unaware of these vaccination schedules that are recommended. So and a lot of times they don't know that there are some services that are given to them for free, like even people living in the low income area. Sometimes they don't know their rights when it comes to there are many organizations like our organizations that are trying to help these people who are in desperate needs. So because they are not aware of these rights and responsibilities, a lot of times they fall short. So maybe parents don't know that their child needs to get vaccinated, or their child needs to get tested, and they don't have any idea about the vaccination schedule that is recommended by CDC. So those are some of the things that I believe that we still need to work on to make more people educated on those areas, so that they become more informed and they can make more informed decisions.
Great, thank you so much. I think that makes a lot of sense, and it probably resonates with a lot of newer immigrant communities in general in the U.S. So I think that we will wrap up at this point. I just wanted to thank everyone for joining us today, taking some time out of your day to have this really great discussion and focus on South Asian communities. And wanted to highlight that this is National Minority Health Month. And so really glad to be able to highlight a specific community during this month, and that we need to be talking more about certain communities that are highly impacted by hepatitis B. And so I wanted to also thank our presenters, Adiba, Shaylee, Abdullah, and Mohammed, for sharing your time and your expertise with us. Thank you for all the work that you're doing to eliminate hepatitis B, and that the work that you're doing focused on South Asian communities. And I think there are a lot of people out there that are interested in joining your efforts and getting copies of your materials. So we will be sharing all the presentation slides, as well as a recording of the webinar with everyone today. And I'll also be sure to share a link to the New York City materials in our follow-up messages as well. Thank you everyone again for joining us today, and please be sure to fill out a brief survey on other topics that may be of interest to you that we can share in the future. Have a great day, everyone.
Thank you very much.
Bye, thank you.
Thank you,
Thanks,
everyone.
everyone.
Take care. Have a great day.